位媒体朋友，大家下午好，欢迎参加国务院联防联控机制举办的新闻发布会。当前，我国仍然面临境外疫情输入和本土疫情传播扩散的双重风险，防控形势依然严峻复杂。要坚持人民至上、生命至上。 坚持外防输入、内防反弹总策略和动态清零总方针不动摇，统筹疫情防控和经济社会发展，坚决落实四早
Zero-COVID policy. We must coordinate between the pandemic control and economic development. We aim at early discovery, quick control, and quick prevention of transmission. We must adhere to the version 9 guideline and improve our capacity in prevention and control to ensure people's normal life and work. We cannot simplify this procedure and adopt a one-size-fits-all policy. And the State Council Joint Prevention and Control Mechanism will step up our efforts of prevention. Today, the topic is about precise prevention and control of the pandemic. We have invited Deputy Director General from the Ministry of Education, Liu Peijun, from the CDC, Level 2 Investigator Hu Xiang, from CDC, Level 2 Investigator Madame Tuo Jia, and from Peking University, the first affiliate hospital director Wang Huiqiang. They will take your questions together. Now we open the floor to the media groups. Please raise up your hands and please identify yourself before raising the question.
第二排靠过道第一位男记者。
谢谢主持人。人民日报记者提问：近期这个内蒙古、新疆等地的这个
From People's Daily.
比较多，然后
Recently in Xinjiang and in Mongolia, the newly added confirmed cases amount to a large number. In Guangdong and Henan provinces, the pandemic is attracting attention as well. So, nationwide, what do you think is the overall situation? Madam Hu Xiang. Thank you for your question. In recent days, the daily newly confirmed cases are rising in fluctuation. So the pandemic is breaking out in several spots, and it has a wide coverage because of the high transmissibility of Omicron variety and the cross-regional outbreak, as well as the new outbreaks in combination with the old positive cases. And we have seen some concentrated outbreak in Zhengzhou and other cities. And in Xinjiang and Inner Mongolia, they are taking tough measures to control the pandemic. In Guangdong, Fujian, Heilongjiang, Hebei, Henan, the partial outbreak of the pandemic is slowing down. In other provinces and municipalities, the outbreak is mostly sporadic, so it's basically within control. But I have to stress that since we continue to be challenged by the influenza and other diseases in the winter season and the imported cases from elsewhere, the risk of having a high concentration of positive cases is still with us, and we might have a combination of risks composed of both the COVID-19 and influenza. So the CDC will continue to commit ourselves to the dynamic zero-COVID policy and take precise and stringent measures to implement the containment measures so that we could quickly cut it off and avoid any concentrated outbreak. Next question.
谢谢主持人，新华社记者提问。我们知道，之前国家卫健委的官网上是开通了
From Xinhua News Agency. Previously, the National Health Commission website has such a comment column to collect the opinions from the public. So, what measures have been taken based on the feedback from those comments? Thank you for the question. We have organized the opinions collected from the column, and there are three main comments. One comes from the idea that the mandatory isolation and returning of the people coming from low-risk areas. Particularly, we have received complaints from Taiyuan and Henan province. And the second comment is about scaling up the risky areas. For example, we have received complaints in Zhenzhou. And third, the isolation risk population coverage must be specified. The National Health Commission and CDC put high premium on the complaints from the general public. So every day we will take measures and urge the different localities to be responsible for handling those issues. We found out that in some localities, the containment measures might be one-size-fits-all, or there might be some bureaucracy issues. For example, there might be charges in the isolation places, like in Bijie City and Nanchong City in Sichuan province. Secondly, the lockdown may replace the management measures, for example, in Zhenzhou City. Besides, according to the public opinion, there might be the limitation of traveling of certain population that are unreasonable. So we are taking measures to handle those issues. We want to avoid the bureaucracy and the unreasonable containment measures. We must effectively coordinate pandemic prevention and the economic development. For the formalism and bureaucratic issues, we must curb them and sanction against any simplification or one-size-fits-all measure. The certain authorities must notify the responsible people immediately and ask them to correct their behaviors. Otherwise, they will be held accountable and be punished. Next question. From CMG, we've noticed that recently some localities have changed their containment measures. For example, no checking is carried out of the nucleic acid test of the railway passengers. And in some places, the nucleic acid tests will be charging instead of being free. So does that mean the policy will change as to the containment? Thank you for the question. Ever since the outbreak of the pandemic, we give first priority to people and life. And we adhere to the dynamic zero COVID principle so that we could have quick discovery, settlement, control, and treatment. Based on the features of the variation of the virus, we dynamically adjust our containment measures, safeguarding people's health and safety. We highly coordinate between economic and social development and the COVID-19 control. The practices have testified that our policies and measures are scientific and cost-effective. Right now, the international community is challenged by the winter season influenza. So there might be some other risks coming from the other infectious or respiratory diseases. The situation is complex. We commit ourselves to the dynamic zero COVID principle, and we organized some experts to study the incubation period, transmissibility of the new virus so as to improve our containment measures. And we hope to further coordinate between economic development and the pandemic control. Next question. From China Education TV. We have seen several places under the risk of the pandemic, and we received the complaints that their schools have been closed down because of the pandemic. So how to take scientific measures of containment to guarantee the basic life and learning experience of the students on campus? Mr. Liu. Thank you for your concern about the optimization of pandemic control on campuses. Ever since the autumn semester begins, the Educational Authority has been implementing the fundamental principle of containment measures so that we could dynamically readjust our containment measures scientifically and coordinate between the pandemic prevention and control and educational undertaking development. Now, the overall situation is under our control, and the order on campus is in place. In October, the Ministry of Education has just convened a conference about the on-campus pandemic prevention and control, identifying that the scientific and precise on-campus pandemic prevention and control must adhere to certain basic requirements. We cannot drop our vigilance and slack so as to avoid any cases found on campuses. On the other hand, we must not take exaggerated measures to undermine the faculties and the students' basic lives and learning. So we must readjust our on-campus containment measures. Firstly, we will scientifically implement the regular prevention and control measures and still conform to the version 9 guideline. We continue to insist on the prevention of both the population, the objects, and the environment to avoid the transmission of the virus on campus or the spillover of the virus from the campus. And secondly, we must improve the humane level of our management. On campus, we cannot go too loose or too stringent. So we must dynamically readjust our teaching and curriculum designs. For example, we must change between online and offline teaching immediately based on the situation. We must maximize the offline teaching experience, but if we have to go online, we must not undermine the teaching quality. And third, we must continue to optimize our on-campus services and coordinate between the logistics guarantee on campus and the pandemic control. For example, we must ensure sufficient supply of not only teaching materials but also the anti-COVID-19 materials. We must ensure the quality of food and have reasonable pricing mechanism. And we must also ensure the efficient delivery services to the students, and the students could have a better environment of study, and the teachers could have a reassured environment of working. And fourth, we must respond immediately to the students' needs. There must be a pathway and a channel for the students to give feedbacks and establish such a mechanism for such a Q&A. And we must give attention to the immediate and urgent matters and guide the faculties to foster such a spirit of COVID-19 fighting and hold themselves accountable. We must work as one mind and one heart to conquer the difficulties of this time. And fifthly, we must build our capacity. We give first priority to prevention and implement full measures. The campuses must have such a contingency plan to respond to any outbreak and have certain guarantee measures. So they must build their capacity in response. We must commit the campuses to the joint prevention and control, and the local authorities must subsidize with certain materials and professional services and pivot more towards the schools locally. Once a virus is found on campus with the local government support, the school must be able to quickly respond and have a quick discovery, quick decision-making procedure, and have a regular management of the campus and return the school to normal practices as quickly as possible. Next question. In the winter season, influenza is plaguing us. How to differentiate between, for example, the influenza, pneumonia, and COVID-19? What measures can we take to tackle that issue? Mr. Wang will take your question. As we know, influenza and common cold belong to respiratory diseases. They share similarities with the COVID-19. Speaking of the differences, like the pathogens, for common cold, there might be some viruses, like the cold viruses. As to COVID-19, there are certain specific viruses as well, like Omicron. And speaking of transmissibility, for common cold, it's not infectious. It resides in your lower respiratory system. And for influenza and COVID-19, they are contagious, but COVID-19 is even more contagious compared to influenza. That you might agree. And third, for the common cold, the virus is usually in the upper respiratory system, especially among the elderly people, and that's the same with influenza. But for COVID-19, it may lead to pneumonia. Of course, for the new variation of the virus of COVID-19, the possibility of pneumonia incidence is lower, but we cannot drop our vigilance. And speaking of the time of outbreak, for common cold, it can happen anytime throughout the whole year. As to influenza, it's mainly breaking out in autumn and winter. For COVID-19, it's also all year round, but in the winter season, that's the most vulnerable season. So we are under more pressure and facing higher risk of any infection with COVID-19. As to the symptoms, for common cold, they are mild. For example, sneezing or low fever or nasal obstruction. For influenza, you may have a headache or muscle pains or throat pains. It's more severe than common cold. As to COVID-19, some may be asymptomatic, some may have mild symptoms, some may be infected with pneumonia. So usually the symptoms of COVID-19 are more severe than cold or influenza. For example, it's commonplace to see a patient infected with COVID-19 to lose the sense of taste, and especially among the elderly people, after infected with COVID-19, the underlying diseases may be worsened because, as we already have known, the COVID-19 may lead to thrombus. For the people, like the elderly people already suffering from the cerebral disease or cardio disease, the COVID-19 infection may worsen their situation. As to treatment plans, for common cold, we don't suggest any treatment because usually you will get over the cold after like 3 days. You just need to rest enough and drink enough water, because it's self-confined. As to influenza, we may suggest some drugs, like antivirus drugs. For COVID-19, we also have some available choices of medication. Especially, we will administer such drugs in the early days among the elderly people with underlying diseases. There might be the offering of antivirus diseases or TCM or rehabilitation. Anyway, the three types of diseases share similarities, but they differ greatly in some ways. So we stress that once you have caught the symptom of fever, please go to the clinic to differentiate between the three. If you have an influenza, you should take some drugs. As to COVID-19, you must be isolated to cut off the further transmission. And meanwhile, you must keep a close monitoring of the evolvement of the disease so that the severe symptoms might be prevented. And the elderly people may improve themselves by curbing any worsening of the underlying diseases. Next question.
谢谢发言人。中央广播电视总台 CGTN 记者提问。正如刚才的介绍，近期疫情
From CMG, CGTN.
地区疫情防控层层加码。
As has been introduced, there are some sporadic cases found elsewhere, and that's causing some inconveniences to people's daily lives. So what measures will be taken to urge the different localities so that their measures will be more scientific and precise? Tuojia will take the question. Thank you for that question. To urge the localities to take more scientific and accurate measures of containment. Firstly, the panel must be playing a bigger role. We must have a log to record certain problems and check them if the problems are solved. And we urge the localities to solve the complaints of the general public. Second, be problem-oriented and solve the most urgent concerns of the public. We urge the localities to correct their behaviors if we receive some complaints. Third, we must properly settle the issue of bureaucracies. And for some localities, if their measures are insufficient, we must expose them as well. Fourth, we must give first priority to the people, for example, by dispatching enough materials and supplies to guarantee the supply for the vulnerable population like the pregnant, women, and the elderly. Seventh, we must give enough support and understanding of the masses to avoid simplification of the treatment measures and to avoid any one-size-fits-all measure. Next question.
谢谢主持人。封面新闻记者提问：奥密克戎传播速度快，隐匿性强。
From the cover,
是 BA.5的2.0值非常高。
Omicron is transmitted very fast and it's insidious. Some people say that for the usual people to take the usual protective measures like wearing masks and having a social distance might not be enough. So what's your take on that? Mr. Wang Guiqiang. As you mentioned, Omicron has higher transmissibility, and the new variants might have higher transmissibility, causing more difficulties to our containment. And because of that property, if some people are asymptomatic carriers and they do not have active screening, then the large number of asymptomatic carriers might be source of transmission and lead to more wider outbreak. Based on our current measures, if properly implemented, we can efficiently control the transmission of the variants of COVID-19. The current measures include like sanitation of your hands, social distancing, wearing facial masks. They're still efficient in terms of avoiding being infected individually. Especially, they play a big role in cutting off the transmission of the variants. For the infected people, wearing facial masks can greatly reduce the risk of further transmission and cut off the chain of transmission. Especially indoors and in places where there is gathering of population, wearing facial masks is a must. It's paramount. But of course, wearing it scientifically and properly matters as well. Some people wear facial masks, but they don't cover their nose and mouth. So the facial masks must attach closely and seamlessly to your faces to avoid further infection. And when you take off your facial masks, use two of your hands to take it off and do not touch the outside of the masks. If the virus attaches to the outside of the facial masks and you touch it, then you might be infected. Besides, we advise you to change a new facial mask every 4 hours. If the facial masks are moist, please replace them with the new ones. In addition, social distancing and hand sanitation are also effective means to prevent the infection of Omicron, even though it's more difficult to fight against the virus. If you contact some virus, hand sanitation will work. And for respiratory infection, the hand sanitation will be helpful as well. So good habits like the hand sanitation can greatly reduce the transmission and infection. As to social distancing, it's the same thing. When you are eating out, you have to take off your facial masks. So then you must keep a social distance from the others to avoid any saliva infection. Personal habits matter, like sneezing, coughing. Please cover your nose and mouth when you do that to avoid any splash of the saliva. Anyway, right now, even though the Omicron virus has higher transmissibility and our containment difficulty rises up, personal and individual measures are still the same, like wearing facial masks, social distancing, and hand sanitation. Thank you. Next question.
谢谢。每日经济新闻记者提问：疫苗接种是疫情防控的重要环节。请问我国目前新冠疫苗接种的最新情况？
National Business Daily. Vaccination is an important part of containment. What's the current update of the vaccination situation, especially among the elderly population? What's the number of the elderly people receiving boosters? Thank you for the question. By November the 4th, the cumulative reported vaccination reached 3.44 billion doses, and 1.3382 billion population have been vaccinated. For the population completing the doses, the number is 1.27 billion. And the population covered and the population completed take up 94.28% and 92%. As to boosters, sequential vaccination was about 40 million. As to elderly people above 60 years old, 230 million people have been vaccinated. 228 million population have completed the doses. And the ratio was 90.6 and 80% respectively of the total population above 60 years old. As to elderly population above 80 years old, the vaccination ratio must be further improved because this population might suffer from severe symptoms and even have life threats after being infected. They especially need the protection from the vaccines. So we must continue to urge the vaccination among the elderly population. Thank you. From China Youth Daily. In the winter season, the incidence of the respiratory diseases is higher. How to arrange the prevention of those diseases on campuses? Thank you for your concern of the health of the youth. Recently, nationwide, we have sporadic outbreak of the virus, especially added by some infectious diseases like influenza in the winter season. Scientific management on campuses is more daunting. To implement the national policies of containment, educational authority focuses on preventing the transmission of COVID-19 and delivering health to the faculties. We've done the following work. Firstly, scientific implementation of the national containment measures and contingency plans, especially the health monitoring for people entering or exiting the schools. We will strengthen the classrooms, labs, and libraries, cafeteria, dorm rooms, the hospitals on campuses monitoring. And for the susceptible posts, we will monitor the population on posts to guarantee the safe order of the campus. Second, prevention of several diseases at the same time. While preventing against COVID-19, we will comprehensively implement the on-campus health management policies, particularly for influenza, measles, smallpoxes, chickenpox. We will keep our monitoring and discovery to avoid its transmission on the campus. For the key places and key population, we will step up our ventilation work and sanitization and disinfection so that the faculties and students could enjoy safe meals. Third, health education. In the winter season, the students are under huge pressure of examination, so we must guide the students to exercise more and have a reasonable arrangement of their daily lives and maintain their health and be energetic. We ask the faculties and students to coordinate with us in terms of the containment implementation, and they must be responsible for their own health. Fourth, improve our health service level, especially in the primary and secondary schools. There must be enough fitness facilities on campuses, and we must have some technical education to have the daily management of those places. We will take pragmatic measures to improve our health service delivery capacity. Fifth, build health schools. While tackling the issue of the COVID-19, the health authority has launched such a plan called Health School, supporting different localities and schools to establish themselves as the health schools models, so as to cement the containment achievements and turn their experience of fighting against the COVID-19 into the long-term mechanism of health delivery. The schools must build their capacities of guaranteeing health, including sanitation management, health promotion and facilitation, and COVID-19 prevention and control. We will guide the different localities to play a positive role in health services. Next question.
谢谢香港中评社提问。老年人的免疫功能减弱，特别是有慢性基础疾病的老人，是感染新冠病毒。
The elderly people have poor
请问针对老年人
immunization capacity.
老年人，在预防方面
They are the most risky population. For the elderly people with underlying diseases, what are the effective means of prevention and control? Mr. Wang Guiqiang.
像你提到老年人有基础病的，这个感染新冠以后呢，容易导致重症和死亡，这是从目前的
As you mentioned,
国外的数据都已经证明了这一点。
the elderly people, if infected with the COVID-19, it may lead to death.
免疫制的人群容易这个导致病情的恶化，基础病的诱发。
They have poor immunity against the virus. The underlying diseases might be a trigger, and added by the COVID-19 infection, they may lead to fatal symptoms. According to version 8 guideline, there are 6 risky population groups, especially the elderly people with underlying diseases. How to prevent the COVID-19 infection and severe symptoms for the elderly people? As to prevention, vaccination works. Even if you have been infected before, vaccination is still helpful because it can avoid repeated infection. Personal protective measures like facial masks, hand sanitation, work as well among the elderly people. But as we see, Omicron has higher transmissibility, so prevention is very challenging. Secondly, we must prevent severe symptoms and death cases, so vaccination is the most effective means. In China and abroad, vaccination can effectively reduce the risk of severe symptoms and deaths among the elderly people.
同时呢，这个必要的一个手段就是疫苗接种。刚才这个部长
Vaccination is necessary.
总体疫苗接种这个接种率很高。
As Hu mentioned,
尤其是80岁以上老年人，疫苗接种率呢。
the vaccination ratio is very high in China, but for the population above 80 years old, the vaccination ratio is falling short of our expectations. So we are calling upon the people above 80 years old to be vaccinated actively to avoid any severe symptom or death risk after infection. Thank you. Last one question.
第二位男记者。
谢谢主持人，凤凰卫视提问。我的问题是和流感相关的。那马上进入冬季之后呢，也
The
是
Phoenix
高
TV.
那么请问我们
My question is about influenza. In the winter season, influenza is very risky. How can the common people protect themselves to avoid any infection with influenza? Madam Hu Xiang. Thank you for that question. The most efficient and economical way is vaccination. You can be vaccinated with the influenza vaccine to avoid infection and the severe symptoms if infected. Meanwhile, have good sanitation habits is another effective means. For example, first, healthy lifestyle can build your body and improve your immunity. In your daily lives, you must have enough sleep, nutrition, and exercises. Second, have good sanitation habits to reduce the risk of infection. For example, influenza or any other respiratory disease. If you cough or sneeze, use handkerchief or tissue to cover your nose and mouth. And after that, please wash your hands and avoid any touching of your nose, eyes, and mouth with your hands. Third, in your family and your workplaces, clean them and keep them tidy. If there is any family member infected by influenza, and when you take care of them, wear facial masks and disinfect the polluted floors and avoid going to the public places with the gathering of population to reduce any contact with the sick people. And finally, we urge everyone to be vaccinated. If you have any symptom of influenza, the patient should stay at home and take enough rest to avoid any further transmission. If you have severe symptoms, go to the hospitals immediately to get immediate treatment. Thank you. Today, our experts introduced to us about precise and scientific containment. And as to the localities, they pose some clarified requirements. There are some behaviors and cases that might be bureaucratic or one-size-fits-all. And the experts also touch upon the alerts concerning the prevention of influenza. So thank you for them. And this is the end of today's presser. Thank you for watching.